On health care, I often say we don't have a health care crisis in America, we have a health crisis. So what we really have is a disproportionate amount of money that's being spent on what would be preventable or curable, but the lifestyles of Americans have created this extraordinary economy of disease. And the whole system is upside down. Insurance programs will pay for a $30,000 foot amputation, but won't cover a $150 visit to the podiatrist that might have prevented it. It'll cover the quadruple bypass at $100,000 to $200,000, but it won't provide $200 to go see a nutrition counselor and try to learn how to eat low glycemic index foods so that maybe you don't end up with the high blood pressure, the diabetes, and the heart disease. We don't pay for screenings, but we'll pay for stage 4 cancer. I mean, the whole system is nuts. It doesn't make sense if what you're really doing is building an intervention-based system that intervenes at the catastrophic level when you should be focusing on a prevention-based system that keeps us from ever getting there. The challenge is not universal coverage. Frankly, we could afford that if we had a healthier population. But the current system, and this is staggering, 15% of the population uses almost 85% of the total resources. So we have a system that is completely upside down, and the reason that we can't afford for universal health coverage is because it's like turning a group of obese people to run loose in an all-you-can-eat buffet and tell them they'll never have to pay the bill. It's not going to result in healthier food choices at that point. So the answer is you create incentives so that people have reasons to make the better lifestyle decisions. It becomes in their economic best interest. We did that in our state by giving discounts on health insurance up to $500 for doing a health risk assessment. We eliminated co-pays and deductibles on the basic screenings of mammography, prostate cancer exams, and colonoscopy, because we found that a lot of people that should be getting those screenings weren't doing it. So when we asked them why, well, if you have a co-pay and deductible that's several $100s, you know what? If you don't present symptoms, you're not going to go. When that $200, $300 could send your kid to summer camp for a few days. So do I want to, go to the gastroenterologist and have him scope me? Done that. It's not very pleasant. Or do I want to get rid of my kid for a week? Guess what I choose to do? That's an easy call. Take the deductibles and the co-pays off, and women get their mammograms. Men get their prostate cancer exams. And you don't have people waiting until they're in a significantly advanced stage of cancer before you get the diagnosis, and then the treatment becomes extraordinarily expensive, cost prohibitive, and the costs are passed on to the payers. It's what we currently have, which is a culture of disease. Even doctors, they're not compensated for making you better, they're compensated for a point of service. And so doctors need to get you in and out of that clinic in 15 minutes or less, or they're losing money. So their goal is as many people as they can, and I'm not saying doctors are purposely trying to just run people through, because that's not fair to them. I think they truly are interested in the healing arts. The trouble is the system does not allow the doctors to practice their craft. The system forces them to move people through in less than 15 minutes. The system also does not really give them incentives to lower your blood pressure, A1C, hemoglobin, and cholesterol. But the system rewards them for seeing you as often as possible or doing a procedure on you. What about a bonus as the physician actually works with the patient to deliver a quality of care that results in a quality of life and a quality of health of the patient? That'd be a radical departure, but it would change the whole dynamic so that the system is based toward healthier lifestyles, healthier people, as opposed to just making sure that people are in the system.